Allison.
Hi, my
Hello.
name's Allie. I'll be your PA today.
Okay.
So tell me what's going on.
I have it was like a bump, and it's really dark, and then it hurts. It's a lot of pain, and it's kind of bleeding.
Oh, it's bleeding?
It was, yeah. When you touch it, and it gets agitated and bleeds, and it hurts.
Okay.
And it's gotten like I thought it was like maybe a pimple I had picked at, but it like hurts in a different kind of like hurt.
Okay.
And then it got bigger, which pimples don't usually do that.
Yeah.
Yeah. So it was kind of concerning.
So how long ago did you notice this?
Maybe about. It started about maybe a little bit more than 2 weeks ago.
Okay.
And then it got bigger and started bleeding and stuff. When you touch it, it kind of like bleeds and stuff.
And did you have any injury to the site or?
No, not at
No?
all.
Was there like a freckle there before or anything? Was there?
Yeah, it was almost like a freckle and then it like kind of itched and it kind of hurt, and then I like picked at it, and then I was like, oh, it's probably a pimple, and it got bigger and bigger, and it's really really dark, like a black color.
Okay.
Yeah.
All right. And you're having pain.
Yeah, it hurts like to the touch and stuff, and sometimes it kind of like just hurts. Yeah.
And what have you been doing to make it better or worse?
I put Neosporin on it, but that didn't really do anything. Other than that, I didn't do anything to it.
Okay. All right. And does anything make it worse? So touching it, you said, makes it painful.
That's it. That's basically it. Because if I touch it, it like starts to kind of like bleed around the edges and stuff.
Okay. So you're having bloody discharge from it? Any like pus or fluid-like discharge?
No, just like it's like a blood, but it has like a clear fluid in it.
Okay.
Yeah.
All right. And have you experienced this before anywhere else on your body?
No.
No. So you just have that one spot, the black mark?
Yeah.
Okay.
Yeah.
Okay. And have you noticed any other changes in texture or color of your skin? Or
No.
just in that area?
Just in that area.
Okay. All right. Okay. So is that your only concern for today? Just that one spot?
Yeah.
Okay. And have you seen another doctor about it, a dermatologist or anything? Have they said anything, or is this your first time seeing a medical provider about it?
Dermatologist? No.
No. Okay. All right. So, do you have any allergies?
Yeah, I'm allergic to penicillin.
To penicillin?
Yeah.
Okay. Have you taken penicillin recently?
No, I don't
No.
take it because I have an allergy to it.
Okay. Okay, that's true. Okay. And are you on any medications?
I take sleeping medicine.
What kind of sleeping medicine?
Mirtazapine.
Okay. All right. And do you take that every day, or?
Yeah, except for Saturday and Sunday, I don't take it. Or
Okay.
Friday, Saturday, Sunday, I don't take it.
And is that prescribed by a doctor, or is it over the counter?
It's prescribed by a doctor.
Okay. All right. Any other vitamins or herbal supplements?
When I work out, I'll take like a pre-workout, but it's non-stimulative.
Okay. All right. Okay. So, so I know that you're concerned about that, but I'm going to get into a couple other questions just about your past medical history, just to see what, if there's any relation to what may have happened in your past that could correlate with this. Okay.
Okay.
Okay. So it does it hurt right now?
Yeah, it does.
Okay. Okay. Maybe I could get some gauze or something to put on top of it so that to try to just relieve some pain.
Okay, thank you. Okay.
Okay. So just try to hold it there a little bit to keep the bleeding from happening, and then we can take care of it later too
Okay.
after the exam. Okay. So just tell me a little bit about your past medical history. Would you say that you had a pretty healthy childhood?
Yeah, I think so.
Okay. And are you up to date on your childhood immunizations?
Yeah, I had all my childhood immunizations.
Okay. And did you have any significant diseases or any illnesses in your childhood? Any chicken pox, meningitis?
I had chicken pox when I was little. I had walking pneumonia when I was 12.
Okay.
And I think that's it.
And the walking pneumonia, have you experienced that anymore, or it was just
No, just when I was 12.
Okay. All right. And any surgeries in your past?
No surgery.
No. Any other hospitalizations?
When I was little?
Yeah, sure. If you were little,
No.
or any recently too.
No, not at all. Not at all.
Not at all. Okay. All right, so that's good. Any other accidents or injuries that may have occurred? No.
Not that I can.
No. Okay. And then for health maintenance, are you up to date on your immunizations? You get a flu shot usually?
Yeah, I got a flu shot yesterday.
Oh, okay, good. All right, so do you have any pain from the flu shot or anything? I know sometimes people say that they get.
No, not really.
No? Okay, all right, good. Okay, and then so you're saying that you have this, you had a spot on your arm. It gets irritated when you touch it.
Mhm.
It bleeds a little bit.
Mhm.
It's causing some pain. You
Mhm.
haven't seen anybody else about it. So, have you noticed that anybody in your family may have experienced this at all?
Not to my knowledge, no.
No, no. Okay. Um, are there any other family diseases that run in your family, such as coronary artery disease or any congestive heart failure?
Oh yeah. Yeah, like well, I have a lot of diabetes in my family.
Okay.
And heart disease.
Okay.
Stuff like that.
Could you tell me who?
Both my grandmothers are diabetic.
Okay.
My mom was diabetic. My dad has. They said he has pre-diabetes or something that he can like adjust his habits and he could like not get it.
Okay.
And then my grandmother's. Well, my dad's mom has like high blood pressure and she has what's it called, congestive heart failure.
Mm-hmm.
And my grandmom on my mom's side, she had a heart attack maybe a year ago.
Okay.
But she's pretty old, so I don't know if that's really a big deal.
Okay.
But and then my mom had a heart attack. My mom actually passed away from a heart attack.
Oh, I'm sorry to hear that.
Thank you.
So any of those illnesses, are you experiencing any of them? So any history of, like you said, diabetes, any heart issues with you, any thyroid issues or kidney issues?
No, no, I don't have anything like that.
No?
I even have really low blood pressure. Like
Oh,
it's
okay.
lower than normal, so.
Okay. Have you, has a doctor ever prescribed you any medications for that or anything?
Oh no,
or?
it's normal for
It's
my
normal?
for like my build. I'm smaller, so
Okay.
it's normal to have a little bit lower.
Okay.
Average.
All right. So I'm just gonna talk a little bit about your social history now. So just are you a student? Do you work?
Oh yeah, I'm a student. Right
You're a
now.
student.
Yeah.
Okay. And where are you a student at?
I go to Delaware County Community College.
Okay. And what are you majoring in there?
I don't know yet. I just kind of
You don't
go
Okay.
take general class.
Okay. Are you enjoying that?
Not really.
No. Is it? Do you have a lot of stress? What's your stress level?
No,
with
because
that?
it's community
No.
college.
Okay. All right. And would you say you have a pretty good support system of family and friends?
Yeah.
Okay. That's good. And then would you say you're pretty much healthy?
Yeah.
Okay.
I
And
think so.
so what would a typical meal look like? Breakfast, lunch, dinner for you?
So for breakfast, I usually just drink green tea and eat like a peanut butter and jelly sandwich, but I use like organic peanut butter and I use like whole wheat bread. And then for lunch, I usually have like a green vegetable and a protein. And then for dinner, I usually have the same thing. I don't eat like a lot of starch and stuff because like of the prevalency for like diabetes and stuff in my family.
Okay, good for you. That's good to prevent it ahead of time. So, and then what about any? How often would you say that you drink alcohol in a typical week?
I don't drink.
No, not at all.
Not really.
Okay.
I might have a beer a month, like a beer a month. It's
Okay.
like if a friend comes over, they have a beer.
Okay. And would you say that there's any history of any alcohol abuse or illicit drug abuse in you or your family?
Yeah, but I have like alcoholism in my family, so that's why I don't drink.
Oh, okay.
Yeah.
All right. Well, good for you then. And okay, so what? Okay, what about your sleeping habits? You're in college.
I take medicine that makes me go to sleep, so I sleep really well.
Okay, so the medicine helps you sleep well
Yeah.
at night,
Mhm.
so you don't wake up through the night or anything.
No, not unless my dog wakes me up.
Okay. So you have a dog, and do you live? Do you have your own home?
No, I live with my dad. I just moved home for school, and I just have my dog and him in my brother.
Okay, and is this a one-story home, two-story?
It has an attic and a basement, so I guess it would be like, I guess what is that, like 3 stories?
3, 4?
I don't know how it
Okay.
works.
Okay. So do you have smoke detectors in the house?
We have smoke detectors, yeah.
Do you have carbon monoxide detectors?
I think we have one. I think that's what that thing is.
Okay, yeah, that would be good to check into just to make sure that
Okay.
you have one of those in your house.
Okay.
And so you said you live with your dad and
My
your
brother.
Okay.
Yeah.
All right. Okay, and what would you say a typical caffeine intake? You said you drink green tea in the morning.
Oh yeah.
Is that caffeinated green tea?
Oh yeah, I drink like a lot of green tea.
Mm-hmm.
I drink like a thing of green tea a day, and I have like a 12-ounce coffee too.
Okay. All right, and then what about water?
I try to drink a minimum of like a half gallon a day.
Okay.
Yeah. So I try to
So you
flush
stay
out
hydrated.
all the green tea and caffeine.
Okay, so you stay pretty hydrated.
Yeah, I try to make sure my pee is clear.
Okay. All right. Good for you. Okay, and then I'm just going to go into a little bit of the sexual history, and I ask all of my patients this. I know it's not specifically related to what you came in for today, but I just need to do some screening. Are you sexually active?
No.
You hesitated there. Not currently sexually active, or have you been in the past?
Oh, I'm not currently sexually
You're not
active.
currently sexually active. Okay, so in the past, have you been?
Oh yeah.
Yes.
Mm-hmm.
Okay, with men, women, or both?
Just women.
Just women?
Mm-hmm.
Okay, and what kind of protection or do you use from STDs and STIs?
Well, if I date somebody, I don't have sex with them until they get tested and I get tested.
Oh, okay, that's good. Good for you. Okay, and do you have any past history of any STIs or STDs?
Mm-hmm.
No? Okay. All right, so moving on, I'm just going to ask you a few questions, just general questions about symptoms you may or may not have been experiencing within the past few months. I know we talked about the skin, the rash on your skin, so I'm just going to ask you a few questions. There might be some associated symptoms that could help us further diagnose what is going on with you today. So this weight on your chart, is this your typical weight, would you say?
Yeah, I mean, for the most part, I think I'm a little bit lighter usually, but with school, I think I've gained a little bit of weight.
Okay, so how much weight would you say you've gained?
Maybe 10 pounds.
Okay, and over what time period would you say?
A year.
A year?
Yeah.
Okay. And you just think that that's due to stress, increased stress?
Yeah,
and
probably not.
eating as healthy?
Yeah, well, and not be able to work out as much as I usually do.
Okay. So you say you work out, you're pretty healthy. How often would you say that you work out?
Maybe now like 3 or 4 times a week.
Okay, all right. Okay, so have you had any past experiences with any eating disorders such as anorexia or bulimia? Or, no? Any family history of any of that?
No.
No. Okay. All right. So, have you had any with your skin? Have you had any excessive dryness or oiliness that you've noticed?
No.
No. Okay. And like we said, there's no color texture change anywhere else, just that one area that you had. Okay. Any change in your hair or nails?
Nope.
No? Okay. Any rash or other lesions anywhere?
No.
No. Okay. And then we're going to talk about your eyes a little bit. Do you wear contact lenses or corrective lenses? No. And when was your last eye exam?
I don't even, I have no idea. I don't remember, yeah.
Okay, so you don't go to like an eye doctor because you don't have eye issues.
Mm-hmm.
Okay, so have you had any recent changes in your sight, or
No.
it's not like you feel like you have double vision or anything?
No.
No. Any sensitivity to light?
No.
No? Okay. Any field cuts? So is there anywhere that you feel like your vision is cut out, you can't see in your periphery? No? Any flashing lights?
No.
No. When you close your eyes, there's no like flashing or anything?
Mm-hmm.
Do you ever see like little dust floaters?
Mm-hmm.
No? Okay. All right. And then do you have any pain with your eyes?
No.
No. Okay. And any excessive watering?
Nope.
No. Okay. Okay. And then with your ears, do you have any discharge in your that comes out of your ears ever, other than the typical earwax?
Oh, no.
No. Okay. Any pain? Any ringing in your ears?
Sometimes.
Sometimes?
Yeah.
And when would you say you have ringing in your ears?
Randomly.
Randomly?
I think I have tinnitus. I was in the military.
Oh, you
Tonight.
Oh, okay. You were in the military?
Yeah.
And what branch of the military?
Navy.
For how long?
5 years.
Okay. And did you have to get any supplemental immunizations for that?
Yeah, I got a lot of them.
Do you remember any of them off the top of your head?
I got smallpox, anthrax. I got Japanese encephalitis. I got a lot of shots.
Okay. So you're no longer active with the military?
No.
No. Okay. All right. And how long ago was that?
2011.
Is when you were finished, or is
Yes.
that when you? Okay.
Yeah, when I finished. I'm sorry.
Okay. So you have just have the ringing in your ears from that. Have you ever gone to an ear doctor or anything to?
No.
Okay. So have you noticed a little bit of?
Had it.
A lot of people had it.
Yeah.
Okay. You noticed some of the ringing in your ears. Any loss of hearing? No.
No.
Okay. All right. And then with your mouth, have you noticed any abscesses or ulcers in your
No.
mouth at all?
Nope.
No. Any cavities?
Well, one time I had abscess, but it was because I had a popcorn toss, and they took it out and they squeezed it out.
Oh, okay.
Yeah,
All right.
that's it.
That sounds uncomfortable.
Yeah, I don't eat popcorn anymore.
Okay. that would do it for me too.
Yeah.
And so did you have to go to the hospital for that to get
No,
that
I just had like a weird pain. I went to the dentist, and then they were like, they looked and they said it's a popcorn husk, and they said this is very, very, very common.
Okay.
And they took it out, and then they squeezed whatever discharge was in the gum out, and it was fine. And then they told me to gargle with some kind of stuff for like a week.
Okay, and since then you haven't had any
Nope.
other issues. Okay. Your flossing and brushing habits, do you floss and brush every
Yeah,
day?
I'm really anal about that. Yeah.
Okay, all right. So, and you said no cavities?
I think I've had one cavity my entire life.
Okay. And then when was your last dental exam? Do you go
Maybe
regularly?
8 months ago.
Okay.
I think I'm due for another one.
Okay.
Way due for another one.
All right. So do you have any gum bleeding, or have you ever experienced any gum bleeding, or like
No.
swollen gum?
Mm-mm.
What about with your tongue? Any swollen tongue, or pain, or like a coating on it?
No.
No. Okay. All right. And then for moving down towards your neck area, have you had any stiffness in your neck ever?
No.
No. Okay. Have you had any pain?
No.
Neck pain? No. Okay. Any external beam therapy to your neck or your head area?
No.
No. Okay.
My grandma had that.
Oh, she did?
Yeah.
For what?
Cancer.
Oh, okay.
Oh, I forgot to tell you she had cancer.
She had cancer?
Yeah.
Is she still living?
Oh, yes. She's fine.
Okay.
Yeah.
Okay. And so have you had any lesions on your neck?
I got like a pimple.
Okay.
But that's
other
about
than
it.
that,
Yeah.
okay.
Yeah.
So any, have you ever experienced a goiter? Like a enlarged?
Oh, no. Mm-mm.
No. Okay.
Nothing else.
Any nodules or any swollen glands?
Nope.
No. Okay. All right. Well, I think that concludes what I need to ask you here. Do you have any last issues or anything that you want to discuss with me that,
No.
no?
Nope.
Any other concerns?
No, just this thing on my arm.
Okay. Is that gauze helping a little bit or?
No.
No. Okay. All right. Well, we'll get you taken care of, okay?
Okay.
All right.
Did it not record?